Hello everyone, how are you doing? I hope you will be great and safe as always. I would like to say thank you for watching our video. It's great to see you all. Let me introduce our group, which consists of 4 members. My name is Farita, then there are my team, namely the first is Kristanti, Lina Andriyani, and the last Vena Nurseviyanti. We are from group 10. This is presentation. We will discuss how to explain medication. Before going to the group 10 material of presentation, there will be one question quiz. The quiz is, how many types medication do you know? And I will give you 10 seconds to answer. Well, to know the correct answer, we need to watch the explain of material first. Alright, before going to the material, did you already know to explain medication in English? The vocabulary used? Where can we buy drugs? Can you types of medication? Are you serious? Let's just go to the material.
The first, why is explanation medication important? The first, to educate patients about the medicine. By educate this, it's very important for a nurse to do this. Not only is this activity the responsibility of the nurse, but because most patients are lay people who do not know much about medicine. The next, present to optimize the best use of the medicine. By explaining how the drug should be used or consumed by the patient. For example, whether the drug is taken before or after eating, how many times the drug is consumed, and so on. We as nurses have helped patients to use the medicine as recommended so that later the drug can work properly. The last, present to warn about the side effect or unwanted effect of the medicine. So another reason that is no less important is why we can to explain drugs to patient, because so we can warn patient about the side effect that can arise after taking prescribed drugs such as drowsiness, nausea, dizziness, and so on. So that after explaining the side effects, so it is happen that a patient will not be surprised by the reaction they experience during or after using the drug. Here, we'll explain about the vocabulary related to medicine. Number 1, prescription. In bahasa Indonesia, resep dokter. Number 2, receipt. In bahasa Indonesia, tanda terima. Number 3, to relieve. In bahasa Indonesia, menghilangkan sakit. Number 4, to shake. In bahasa Indonesia, mengocok atau kocok. Number 5, one spoonful. In bahasa Indonesia, 1 sendok makan atau takar. Number 6, pill. In bahasa Indonesia, pill. Number 7, adverse reaction. In bahasa Indonesia, reaksi penolakan tubuh terhadap sesuatu obat atau kontraindikasi. Number 8, drug. In bahasa Indonesia, obat atau pil kapsul. Number 9, medicine. In bahasa Indonesia, obat or cough medicine. In bahasa Indonesia, obat batuk. Number 10, draught. In bahasa Indonesia, obat berbentuk cairan. Next, there are different ways of giving medication to the patients. Number 1. Medication by inhalations. Type of drugs that are inhaled. For example, inhalers for people with asthma. So later, the drug is inhaled to relieve the asthma symptoms they have. Number 2. Medication by injunctions. Treatment by applying drugs or ointment to the surface of the skin. Number 3. Rectal medications. This type is given through the anus to the patients. For example, it is used in patients who have hemorrhoids, constipation, and so on. Number 4. Medication by dropper. Namely drops, for example, eye drops or ear drops that are dropped on certain areas. Number 5. Medication by injections. This treatment is done by injecting the patients. There are several types of injections, namely intravenous, intramuscular, subcutaneous, and so on. Number 6. Sublingual medications, namely a tablet that is placed under the tongue and how to administer the drug through the oral mucosa. Next, what is the difference between medicine and drugs? Number 1. Medicine, a substance which can cure or prevent a disease, replace vital substance that the body lacks and suppress or relieve symptoms. Number 2. Drug, a substance used for minor complaints which generally have obvious benefit and negligible risks. Otherwise, most of us would prefer to put up with the complaint. Number 3. Capsule, a small container which has a measured amount of medicine inside and which dissolves when you swallow it. Number 4. Pill or tablet, a small fat round piece of medicine that you swallow without chewing it. Number 5. Ampoule, a small container usually made of glass containing a drug that will be used for an injection. The next following abbreviation are commonly used by doctors when they prescribe drugs. BID, twice a day. So, what is meant by taking the medicine twice a day? We can take the medicine morning and evening or morning and afternoon. TID, 3 times a day. So, what is meant by taking medicine 3 times a day? Is that we take medicine 3 times a day, namely morning, afternoon, and evening. KID, 4 times a day. So, taking the medicine 4 times a day. We take the medicine in the morning, afternoon, evening, and night. PRN, when necessary. So, taking medicine if necessary. Taking medicine if we are feeling pain. 2. HRLY, 1 every 2 hours. So, when taking the drug 2-hour interval once a day. AC, before meals or before food or on an empty stomach. It is advisable to take the medicine before and after meals according to the doctor rules. PC, 4 times times a day. This is the same as KID, how to drink 4 times a day. EO, orally. This method of drinking by mouth is usually a more practical and safer way to take medicine. Tablets. The way to take with a tablet is usually the drug is placed in the middle of the tongue. Capsules. The way to take this drug is the same as how to take the drug in the tablets. MAR, Medication Administration Record, usually to provide a description of the rules for taking medicine. The next material will be explained by Farita.
So you guys haven't noticed yet. At least we can find drugs. Number 1, pharmacy is one of the combined science of health and chemistry which studies the procedure for supplying drugs in the scarcine forms so that they are ready to be used as drug for a disease. So, pharmacy is a place to make medicine and provide natural resources for medicine. Number 2 is drug. Is a facility that has a license to store free drugs and limited over-the-counter medicine for retail sale. Drugs, which has the rights as an over-the-counter drug seller that has a distribution license. Number 3, dispensary is a shop where drug makes and a place that sell retail drugs either with a doctor prescription and also has a function as a place to sell various other health products. So, pharmacy shop that sell all forms of medicine to cure pain. The last here is a way of speaking or information about taking medicine. Giving direction and explain medication about medicine. Number 1, this is name of medicine to relieve your name of illnesses. Example, this is paracetamol to relieve your headaches. So, the name of medicine to indicate the name of the drug, for example, paracetamol to treat headaches, pain, and how often we feel the pain. Number 2, please take. Example, how much, how often, and when. Example, please take 1 tablet 3 times a day after meals. To inform the rules for taking medicine and the rules for taking medicine according to water. Next, you have to how. Example, you have to take it with water. And you have to shake the syrup first. To information, before taking the medicine, the syrup bottle is shaken first by turning it. And the last, do not exceed 3 tablets per day. Example, do not exceed 3 tablets per day. So, in taking the drug, do not take more than 3 tablets a day so as not to cause an excessive dose. The next, giving caution. Just tell me if there's something you don't understand and I will go over it all. Anything that does not understand should be asked. For example, whenever I have to take medicine and how to take it. You must call the nurse if there is an adverse reaction. A patient when expiration events that are not now should contact the nurse so that they can be examined. Number 3, don't take this more than 3 times a day. So, usually, this tells that the patient is already taking the medicine 3 times a day. Number 4, don't use it if it makes a skin rash. If a skin rash occurs or if the appointment is suitable, the patient is not allowed to use it again. Next, discontinue if an adverse reaction occurs. Likewise, discontinue if an adverse reaction occurs. And the last, they reduce antibiotic all up. If the nurse recommends taking all antibiotic, the patient should take them and according to the doses.
Good morning, nurse. Good morning. What happened, miss? Tell me about your current health condition.
I feel bad. The fever has terminated me since yesterday.
Do you have any other problem besides the fever?
Yes, I am also suffering headache now, and of course, I had a headache.
Let me checking your condition by checking temperature. Oh, right now your fever won't be that bad because it's only about 38 degrees.
Thank you, nurse, for the good news.
You're welcome. I give you a warm compress and some prescription medication, and you'll be better off in a few days. But I warn you to drink lots of water and extend your rest.
Thank you, nurse. Should I rest for a long day?
I advise you to rest for a while. 2 or 3 days or no, you don't need to be hospitalized.
Of course, nurse.
The medicine I give it for 3 days. You need to take the first dose as soon as you come home. The second is after lunch and at night before bed and after dinner. Remember that every medicine must be taken after you eat.
Is there any side effects?
Rare but possible: drowsiness, dizziness, blurred vision, and constipation. It is recommended that you avoid physically demanding activities after taking this, also no driving.
Nurse, any other recommendation? I mean, it's in the food category. What should I eat?
Salt, brown, ripe, fresh vegetable, and fruit.
Okay, nurse, I will follow your advice.
Fine. Any question?
No, thanks.
Okay, miss, no problem.
So, after watching video about explanation medication, there are 6 types medication to the patient. Number 1, medication by inhalation, medication by inaction, medication by dropper, rectal medication, medication by injection, and sublingual medication. After we learn about how to give instruction and provide explanation regarding drug administration, it can be concluded that number 1, the instruction can be carried out if the nurse and communicate properly. Number 2, describe of the procedure, the needs to be given to the patient in order for treatment to be possible going right. And thank you for attention. May all those we have shared and be useful for all for us. Thank you.